So one of the difficult things that I have is grading burns, grading wounds. How do I know what degree this wound is? Patient wound has some black spots on the inside with a 3 centimeter wide and 5 centimeter deep wound. I can see the bone. It is not actively bleeding. No purulent drainage. How do I grade this? How do I grade this? How nurses, if you're in the ER, I know I like to pick on my ER people. Look, I worked in the ER. I was pretty dumb when I was over there. The only thing I was really good at was poking people really well. Grading wounds, I pick a number. And so I'm sure a lot of you new grads or people who don't really care to do wound care, uh, wounds not your thing. Difficult to grade. You're not going to put down a good assessment. Your documentation is going to be garbage. What if Intracav, through your description, very detailed description of what you observed, can now help you to grade? So let's see what Intracav says. So I said patient wound has some black spots on the inside with 3 centimeter wide and 5 centimeter deep wound. And let's say 2 centimeter, 1 centimeter long, or 2 centimeter long and 5 centimeter deep wound. I can see the bone. It's not actively bleeding, no purulent drainage. How do I grade this? Now let's see. ICU nurses, how much would you love it for ER to have access to Intracav? Based on the description, it appears to be pressure injury or ulcer characteristic, which can help determine its with characteristics that can help determine stage. Black spot, eschar. Black spot suggests necrotic tissue or eschar, which often indicates full thickness wound. Bone exposure. Seeing the bone wound bed indicates severe wound, possibly involving deeper tissue layers. Given observations, the wound is likely stage 4 pressure ulcer, according to the National Pressure Injury Advisory Panel. Stage 4 ulcers involve full thickness skin and tissue loss with exposed directly palpable bone, tendon, or muscle. The depth and size aligns with stage 4, absence of drainage. While not always indicative of the stage, absence of purulent drainage suggests that it may not be an active infection at this time, but be vigilant if necessary. It's crucial to involve wound care specialists. Guys, ER, do you want this? Is this going to make your life easier? To have Intracav help you to stage a wound accurate for the providers and for the nurses upstairs. Do you want this in your hospital? Put in the comments. Let your leadership know who might stumble across this video that this is going to be a game changer for you on the floor, for your workflow, so that you can fulfill your tasks more comfortably and more accurately.